Good afternoon. Welcome again to all members of the press, and thank you again for taking the time to listen to this briefing by the Pan American Health Organization on the current influenza A H1N1 epidemic. As I mentioned yesterday, the purpose of these briefings will be to keep you updated on the current situation to the extent possible as it evolves with the best possible information. We also want to share with you evolving scientific information that will enhance our outbreak control. And finally, we want to re-emphasize those measures individuals and communities can be taken to protect themselves and their families. Today, I will be covering 3 items. I'll give a brief recap of the descriptive epidemiology of the outbreak, a summary of yesterday's conclusions, and finally, more detail. I'll provide you more detail with what PAHO is doing to support countries of the Americas, as well as what individuals can be doing, as I said, to protect themselves and their families. To summarize the epidemiological situation, globally, the latest data show that we now have more than 1,000 cases of the new influenza A H1N1 virus from 20 countries around the world. There have been 26 deaths, 25 in Mexico and 1 in the United States. In the region of the Americas, we now have 943 cases. The countries include Canada, Colombia, Costa Rica, El Salvador, Mexico, and the USA. We should not be spending much time counting these numbers. The numbers will rise and drop. For example, as we speak, we know that there are 744 probable cases under investigation in the United States. So that's a significant number, and again, the situation is evolving. But we cannot let our guard down. Our data indicate that transmission, sustainable community transmission exists in the U.S. and Mexico. The following points that I'm going to be covering are important for all individuals to understand, particularly when making decisions such as, should I send my child to school today? Should I be going to work? So they're the following. All flu outbreaks are serious. This one is especially serious because it's a new virus. This means that we have not been exposed to this virus, which means that we do not have protective immunity. The incubation period of this disease is probably a couple of days, but ranges between 2 and 7 days based on our knowledge of the seasonal influenza. The communicability of this disease, that is, when individuals are infectious, so that if we get in contact with them, we could acquire the disease. This period of communicability, as we refer to it, is 1 day prior to the onset of symptoms, so when the individual may appear healthy, to 5 days after. The method of transmission is by droplets, so hand washing, personal hygiene, covering the mouth when coughing, and measures of social distancing remain important. The clinical features of this disease continue to remain mild to moderate. The southern hemisphere is about to enter its winter season. It's the winter season that provides the ecologic conditions and situations that provide for more rapid influenza virus transmission. So the southern hemisphere must be on particular alert and remain vigilant. So let me summarize quickly the major points we made yesterday. First, despite the mild to moderate nature of this illness, we know that things can change very quickly and very dramatically. We know about influenza, and RNA viruses in general are predictable in their unpredictability. And to that end, we reminded ourselves yesterday of the 1918 flu pandemic. It is very important to convey that PAHO and WHO recommend countries not to impose restrictions on travel or close their borders. Research suggests that these measures these aggressive actions will not prevent the spread of disease. The virus has already spread to a number of locations. However, people who become ill should definitely postpone travel, and those who return from travel who are now ill should seek their medical advice. Adults who become ill should also not go to work and avoid public gatherings. Children who become ill should be kept home from going to school. We spoke briefly about the successes in the Americas, referring to the control of yellow fever, the 7th global cholera pandemic that occurred in the 1990s of the last century, and our disease elimination efforts. This gives us optimism and a sense of solidarity that when we have additional tools in hand, like vaccines, countries will do the job necessary to control this outbreak. WHO is leading the world's effort on a vaccine. We have antiviral medications as well that treat acute infection if given early enough. We talked about a range of estimates when the vaccine will ultimately become available for community vaccination programs. Our best estimate is within the next 4 to 6 months. Since our best estimate is 4 to 6 months, what can we do in the meantime? To that end, we call upon all people to practice basic hygiene, such as covering the mouth when coughing, using disposable tissues, frequent hand washing, and staying at home when you're sick, and maintaining those measures of social distancing when appropriate. Make plans to keep your children home when they're sick. Work out contingency plans with your family. Also, work with your community. Again, we cannot overemphasize these interventions and that communities and individuals can be doing. They are simple but highly powerful in their capacity to affect disease transmission. Okay, let's move on to discuss what PAHO is doing to assist member countries in the region. Since the onset of the emergency, PAHO epidemiologists, virologists, and logisticians, with other experts from our partners such as CDC and WHO in Geneva, have been working around the clock with the Mexican authorities and scientists in the Ministry of Health. PAHO has 4 experts on risk communication working with authorities to help ensure that the right messages are being conveyed given our current understanding of this virus. Of high priority has been to clean up the backlog of specimens that flooded the Mexican public health laboratories. You are now seeing that work paying off with a clear picture of the epidemic curve and how the outbreak is evolving within the country. I should spend some time describing PAHO's network of technical cooperation in the regions, supported by our regional office here and by WHO in Geneva. PAHO has country offices in all our member countries. In addition, the Caribbean countries have a sub-regional office with sophisticated laboratory that services the island countries and other countries of the Caribbean geographic area. These country and sub-regional officers are staffed with experts in infectious disease, epidemiology, virologists, laboratory science, and logistics. Our country office in Mexico has been working around the clock supporting our colleagues in the Ministry of Health of Mexico. From this network of country-based offices, PAHO has mobilized teams of experts from unaffected countries throughout the region to travel to Mexico to assist outbreak control measures. Because PAHO works very closely with scientists from Public Health Canada and from the Centers of Disease Control and Prevention of the United States Health Human Services, experts from these offices have become vital members of PAHO's country support team response to this crisis. You've been hearing over and over again that one response to this outbreak is to rapidly enhance surveillance everywhere. What that means is that we are supporting efforts to ensure that all possible cases are being identified and investigated. Importantly, being able to determine whether an individual is infected with the virus or not. We already have a well-functioning network of national influenza centers throughout the hemisphere that forms the backbone of this surveillance work. Guidelines to be used by public health authorities and officials and medical providers covering a wide range of topics are available on our and WHO's website, including guidelines for healthcare setting, infection control measures, clinical case management, surveillance, outbreak response measures, communication strategies, and management and operations of preventive services such as immunization programs. PAHO's regional staff in our administration and procurement units are collecting information from all countries, determining their best forecasts of demand for operational resources, antiviral medications, and vaccines. PAHO has the machinery in place to place orders, negotiate with the suppliers, and ensure that shipments arrive in time. Closely related to this is defining gaps in resource requirements and mobilizing additional resources from our partners such as the Inter-American Development Bank and others. I previously mentioned PAHO's collaboration with the Global Task Force on Influenza A H1N1 vaccine, which is met on a daily basis beginning last Sunday, the 26th of April. In addition, we participate in a number of other global task force and other committees and working groups, including daily conference calls with the International Health Regulations team involving Geneva, the regional and country offices. The Global Task Force on Influenza A H1N1, which conducts a daily teleconference call to share information with all regional offices as it emerges, and a daily teleconference call with the scientists of the Public Health Canada and the CDC. Equitable distribution of vaccine to developing countries is an absolute top priority for our organization. PAHO's revolving fund has more than 30 years of experience working with countries to provide safe, affordable supply chain of vaccines. The revolving fund also has a track record of responding to emergencies. The first urban yellow fever outbreak in the Americas in more than 40 years occurred last year in Paraguay, and the response was excellent, whereby neighboring countries such as Brazil, Peru, Venezuela, and Bolivia donated vaccine to ensure that that outbreak could be stopped in Paraguay. Once influenza A H1N1 vaccine becomes available, by all accounts, the global supply most likely will be limited. Globally, perhaps 1 to 2 billion doses will become available, and this falls far short of the more than 6 billion people living on the planet. Vaccination strategies will need to be targeted to those individuals at higher risk. Again, the data coming out of Mexico, as we discussed yesterday, will be critical for determining the risk factors for morbidity and mortality for targeting such interventions, and will be not only essential for Mexico, but for the rest of the world. So we are working hard with all our partners to fill the gaps in information that will ensure we're providing the best outbreak response. Are we prepared? We probably cannot be ever fully prepared. But the American region, I believe, has never been prepared as it is today to confront this crisis. We are seeing the benefits of the work over the last 3 to 4 years done by PAHO with its partners and ministries of health to prepare for such a crisis. The situation will continue to evolve, and we will keep you informed. So with that, I will stop to answer any questions, and again, thanks for taking the time to listen to this briefing.